Bayonetting sign. Bayonetting sign or double angulation of blood vessel. Now, when you look at the optic nerve head, we are looking at it face front. The rim tissue is visible. The optic nerve head could be thought about as a donut. You have nice thick rim, that's healthy. If you have a thin rim and bigger hole in the center, that would be glaucomatous-like optic nerve head. So bayonetting sign is basically you are able to follow the blood vessels, the origin of the center of the blood vessel, and as you follow the blood vessels, the base of the cup is wider than compared to what you are seeing up front. So when you look at this picture, you can say, all right, so that is the boundary of the optic nerve head. Sorry. That's the boundary of the optic nerve head. There you are. And you can look at the cupping and say, all right, so all that is cup. This is rim tissue. You're following this. That could be vitreous, just translucent structure visible there. A little thickened vitreous. You look right there, here. That's the cup. That's the rim tissue. Okay. Now look at these blood vessels. They seem to be entering here and suddenly disappearing. Well, it's not really disappearing. What's happening is that they are following the base of the cup, and the rim tissue is hiding the base of the cup, and so they are going underneath this way. They are coming out in a different location. And so they travel, they go under the base, they climb up, and they come out of a different location. And that's called bayonetting sign. This bayonetting or double angulation of blood vessel is one of the signs that you should consider or look for in patients with glaucoma. Here's another one. You can look at this blood vessel going in, disappearing, and coming out of a different location. This is most likely underneath the rim tissue, and then it's just coming out of this location right there. So that's a bayonetting sign. We learned about bearing of circumlinear vessel. See, this is a nice arch, like gap there, rim tissue present. This blood vessel wouldn't be arching if not for having support previously and now losing it. So that's an example of bayonetting sign. Here's another one. You look for this and say, all right, this is a large cup with glaucoma. You just learned about laminar dot sign. These are laminar pores visible. Here is a nice, beautiful curved blood vessel with a small gap right there, suggesting that's bearing of circumlinear vessel.